Okay, it's all yours.
So welcome everyone to the June 13th, 2022 meeting of the CB11's Human Services Committee. My name is Isaac Scott and I'm the chair of the committee. This meeting is called to order at 6:05 p.m. Tonight we are joined by Community Associate Marlene Pierre, the staff liaison to our committee. To conduct an efficient meeting, let's go over some ground rules real quick. One, no one may speak until granted the floor. Second, CB11 members, if you have a question about board business or if you wish to make a motion, please raise your hand through the Zoom. If you click the participants icon, the participants panel should appear and you should find the raise hand function. If you still have technical difficulty, you may click the chat icon and relay your difficulty to the staff. The chat function should not be used for CB11 business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information like an email address that was already said out loud on the record during the meeting. So please do say their contact information out loud and then put it in the chat for us. When a member is given the floor to speak, I will identify you and you can unmute yourself so that you can speak. Please keep your questions and comments succinct and germane to the discussion. Members of the public, if you have a question or a comment about subjects on the agenda, please raise your hand through Zoom and wait to be recognized. Okay. And with that, I believe we are ready to do roll call.
Sandy Garcia. Jennifer Meyer. Art Perez.
Here.
Pastor Isaac Scott.
Here.
And Robin Stration.
I am here.
Thanks. You have quorum.
Thank you very, very much. Okay, so next we will move on to the adoption of the agenda. The agenda for tonight's meeting was distributed ahead of time by the board office and was posted online. If there's no objection, we will adopt the agenda, as stated. Committee members, if you object to adopting the agenda, you may raise your hand through Zoom. Seeing no hands raised. I believe the agenda is adopted. The minutes from our last meeting were distributed to committee members ahead of time by the board office as well. If there's no objection, we will adopt the minutes from that meeting. Committee members, if you object to adopting the minutes, you may raise your hand. Okay, seeing no objections, the minutes from the last committee meeting are adopted. They will soon be available on the CB11 website. Okay, next we're gonna move on to our announcements. So first we'll have our budget town hall announcement by Arturo Perez, who's the vice chair of this committee. Art, whenever you're ready. Art, are you there?
Yeah, hi, yeah.
Yeah.
Okay, so the budget committee met and there is a planned town hall budget meeting for the last week in July, but has not been decided yet exactly when that's going to happen. I mean, the budget committee agreed to have a town hall meeting very similar to the one they had last year, apparently. And it is going to be a non-virtual or a hybrid meeting for the location to, I believe, is going to be determined. And I think that's all the information I have on the budget town hall meeting.
Thank you very much, Art. Does anyone have any questions regarding that announcement? Okay. So another announcement is that the mayor signed Executive Order 103 extending the city's state of emergency for 30 days with an anticipated end on June 27th, 2022. So what that essentially means is that we are able to meet as a committee via Zoom until approximately June 27th, and we'll let you know if we hear anything else, or as soon as we hear anything else about whether meetings will be returning in person or if they will resume via Zoom. Okay, I want to also open the floor to any other board members who may have any announcements they may want to bring before the community right now. Go ahead, Rob.
Thank you.
And it's good to see you.
It's always nice to see you, and it's nice to see new faces too, Natalia. Thanks for joining us. My organization, Search and Care, helps older adults remain in the community, and we have two very special workshops coming up. The first is just purely for your edutainment. It's an hour with a wild bird rehabilitator, which I think is probably more relaxing than listening to music. That's June 22nd, but the next one on June 28th is very important to this committee. It's about a bill that's in front of the state legislature called Fair Pay for Home Care. And it's because we are in a home care crisis, as in lack of home care workers. We've had, during the pandemic, we've had clients who require 24-hour home care because they're bedbound, have no workers show up because workers can make more money right now on unemployment, and they don't really get paid so great working for agencies. And we believe that they deserve more. So we're for this bill. If you want to know more about it and what you can do for it, June 28th, go to the Search and Care website, look at our, right on the homepage, you'll see events. You can register for it there. It's free. It's June 28th from 11 to noon. And lastly, I guess this is sort of an announcement, but a question at the same time. Every year up until the pandemic, Metropolitan Hospital, in tandem with our council member's office, put on a senior health fair called Power of Living Well. We learned about it 2 weeks before it was supposed to happen. It was supposed to happen June 8th, but it got canceled because of the weather. So we're hoping it will be in September, which, if it is rescheduled, we'll have lots of time for everybody who's interested to plan to attend or to exhibit there. And that's all I have to share. Thank you.
Thank you very, very much, Robin. I wonder if you could put your website down in the chat from the first announcement you did. On the Fair Pay for Home Care bill. What website should we go to on the 28th? Any other board members? Any other? Thank you so much. I appreciate you. Board members, are there any other updates you would like to give? All right. Seeing none, I'll ask if there are any community members who want to give any announcements right now. So this is a very small group. I wonder if I could get personal. Hi, Natalia. Do you have any announcements that you'd like to maybe just announce who you are? Tell us who you are. That's a great announcement. Yeah.
Sure. So my name is Natalia, and I am the program manager of community strategy at Housing Works. And today I wanted to talk a little bit more about a new mental health initiative that is funded through the Department of Health, but is being executed by Housing Works and 7 other organizations throughout the city. I put together a formal PowerPoint.
I'm sorry, I mean cut you off. So you're actually presenting today on all of this.
Mm-hmm.
Yes, yes, yes. Okay, so maybe I'm sorry. So maybe I made this like a hello. Here's who I am.
Oh,
Thank you.
okay. My name is
Because I'm
Natalia. I'm
about
from
to.
Brooklyn.
Yep. That's yep.
But I
Yeah.
work in East Harlem.
Yep. Yep. Thank you.
So
Thank you.
that's
And I
good
see you.
about
And I
me.
saw you. And I heard you checking in with Marlene earlier. So I know there's some
Yes.
background there. That's what's
Yes.
up.
How
That's
was your
what's up.
sister? You had a twin, right? It's just so interesting because I also have a twin sister. It's just so crazy how this is
Yes,
working out.
she's great. I'll let her know that I saw you virtually. She's great.
Okay, good. Good.
Okay, cool.
You want me to move the slide, Pastor Scott? Or
Huh?
you want me to move the slide?
I'm sorry. Yes, you can. Yes, you can.
I see a hand in the public though. Do you want?
Yes,
me to
that's exactly what I was just navigating my way over to. Yes, I do. Yes, I
Okay.
do. I want to make my way. If Natalia is finished.
Oh, I'm all done. Thank you.
Okay, cool.
Thank you
Thank
for
you
the
very
time.
much. Yes. Yes. Joseph, can I call you by your first name? I don't want to mess up your last name.
Sure. I just joined late, and when I came in, I heard a mention of fair pay for home care. So I was just curious what that was in reference to. I could always watch the recording later, I guess, but I was just curious.
Please, Robin. Please, Robin.
Joey, that was me, your coworker, celebrating your upcoming workshop.
Oh,
Promoting your
about me.
upcoming
Okay.
workshop. Yeah, it's definitely about you. And it's also about fair pay for home care.
Awesome.
Thanks for
more
attending
importantly,
tonight, Joe. Thank you.
Okay. Thank you very much. All right, so we can yes, let's move it on. Let's move it on along. So we'll move on over to our informational updates. We have Pauline Ferrente from the Department of Health and Mental Hygiene. Thank you very much for your patience and for being here consistently and persistently. Yeah, I just want to open the floor to you right now.
Thank you, Chair Scott. I appreciate it. Thank you, Marlene, for inviting me. So as everyone knows, that New York City is still in the high alert level for COVID, which means there is high transmission and cases throughout the city. The good news is we're trending in a downward direction, which is great. However, we don't want people to have a false sense of security. So we are encouraging everyone to continue masking indoors. Masks are still required on public transportation. I know we have been getting a lot of inquiries as to whether or not that is still a thing. It is. So if you are on mass transit, including subways, buses, ferries, and for hire car service like Uber and Lyft, masks are still required. Additionally, there's been an update about boosters. The Pfizer vaccine has now been approved for boosters for children 5 through 12. So if you have a child who's 5 through 12, and it's been at least 5 months since their last shot of their first, 2 doses, they are eligible to go ahead and get a booster. Again, second boosters are available for people 50 plus, or if you're 12 and older with an immunocompromised system. So again, we highly encourage everyone, if you haven't been vaccinated, please go ahead and do so. And if you have completed your first doses of your vaccine, to go ahead and get boosted. That's the best way to protect yourself. So if you do come in contact with COVID-19, your symptoms are reduced, the likelihood of you getting severe illness is reduced. And, it's just helpful to keep you and those around you safe. So those are the biggest updates. The FDA is currently making a decision to approve vaccines for those 6 months to 5 years. We expect that decision to be made hopefully sometime this week. And then we'll be able to work with the rollout of how that would look for people to get vaccinated in the city. But again, in terms of this age group, hopefully everyone already is working with a pediatrician. So we encourage everyone who has a child between the ages of 6 months to 5 years to contact your pediatrician's office just to see sort of if there's a waiting list that you can can get onto or what their office protocol will be when the vaccine is made available. Those are the biggest updates in terms of COVID. I'm happy to answer any questions, COVID or non-COVID related, for the health department. Thanks so much.
Thank you very, very, very much. Are there any questions for Colleen? Please raise your hand. If you have any questions? No questions? Does seem pretty cut and dry. Thank you very, very much again for providing all of these updates. I have a daughter who is 2 years old, so she's the only one in our house who's not vaccinated. So I'm definitely like waiting on this approval with everyone else, you know, for the young people. But it's yeah, that's
Yes, we'll definitely keep all the community boards up to date as soon as the decision's made, and when that information is available, we will be sure to update everybody.
Thank you very, very much. I appreciate
Thank
it.
you.
Okay, so I'll keep it moving. So I'm just gonna note something for the record regarding NYC Health and Hospitals Metropolitan. Natasha Burke is the Chief of Staff for CEO Christina Contreras at Metropolitan Hospital. Ms. Burke is currently filling in for Noel Alicia because his last day at Metropolitan Hospital was Friday, June 13th. So this Friday that just passed. But she couldn't attend tonight's meeting. So I just wanted to let you all know about that sort of change in staff as we hope to have Ms. Burke come for us. I guess when we come back, which will most likely be in September. With that, if there's no questions about that, I don't really have any answers. But if there's any questions about that, if not, I'm going to move us along to our business session. All right, so we're gonna yes. So okay, great. All right, Natalia. So it's actually up on you right now. So we're moving into our presentations and discussions, information and presentation regarding Housing Works, our Community Healthcare Connect. I won't even read anything about it. I'll let Natalia do it because she's already going in and doing a great job. So I won't, skew any of that. Please go ahead. The floor is yours.
Thanks. Can I share my screen with you guys?
Yes.
Okay, let me, that's weird. It's not letting me share. Okay. Show all windows. Okay. Okay. And I should have the option to hold notes. Okay, can you see the slides?
Yes.
Awesome.
Yes,
Okay,
we can.
great. Thank you again for having me today. I'm really excited to talk to you about this new mental health initiative called Connect. Again, I am Natalia, program manager from Housing Works. This is a new mental health initiative that is funded by New York City Department of Health, Mental Hygiene, and yeah, let me just get right into it. So a few years ago, the city did an assessment of the state of mental health within the 5 boroughs, and it found that we were in trouble. We had a lot of things, we had a lot of concerns, a lot of things that we needed to do. There were high call volumes of New York City Well which is a mental health crisis line. You can call in if you're in crisis, or you can call in if you're in need of any mental health services or referral. But there was a high call volume. Also more of a demand than capacity of support for folks that were in need of behavioral health services. There was also a high suicide rate, high prevalence of depression. There were a lot of psychiatric visits and inpatient psych visits. So many more referrals to mobile crisis teams were being made. So many more referrals to mobile treatment services being made. And with the number of COVID rates, mortality rates were really high. Chronic illness was really high. So we were not doing too well. The rates of poverty was really high. And there was also a concern for folks that were recently incarcerated that were being integrated back into the community. They were not utilizing the service. So, through this assessment, we found that we had a really, really large mental health need. And in response, the city developed a program called Connect. And Connect, let me go back here. Let's bring this down. But Connect stands for Continuous Engagement Between Community and Clinic Treatment. It's a community-based program that expands the capacity of existing licensed OMH and Article 31 mental health programs by engaging the clinic surrounding community in the development and design of enhanced services. In a nutshell, it's a program that's designed to utilize the support of the community to provide us with an agenda on how we can help, because who knows better than the community itself of what they need. And I know I'm preaching to the choir because I'm talking to the community board, and and I'm assuming anyone who attends this meeting, anyone who's a part of the board, they all understand the importance of community engagement and advocacy. But it is with the help. This program does not exist without the help of the community. So some of the services of the Connect program is to, like I mentioned, work with the community to inform the clinic and to inform of clinic and non-clinical services design and delivery. So literally the community is telling us what needs to happen. If a community member says, hey, there has been garbage outside of my apartment for this amount of time and it is affecting my mental health, that is our role. Our role is to work with the community to see what is that we can do to remove that garbage can out of their way, because we understand how that affects their quality of life, right? And at the very cost of the services that we're providing, right, it's a mental health initiative, right? And so we are working with the community and understanding that traditional mental health services or traditional behavioral services is not for everyone, right? There are about 75% of folks that utilize mental health services that are actually using it the traditional way, and that being going in to a clinic, a private provider, to receive treatment. But there are folks where that doesn't work, and so we are literally meeting the community where you're at. So we are bringing these interventions over to you. Right, we have community health therapists that are willing to walk into the community and provide you therapy on the spot. We are creating what we call activation centers, where we will work with community members or business owners to allow us the space and the time to provide mental health services at your local coffee shop, your local bodega, the libraries, the park. Because we understand that the model that we have for mental health right now obviously isn't working, which is why we have such a high need. In addition to traditional clinic services, we also provide non-traditional services, right? So case management, right? Let's say someone is in need of, I don't know, vocational support, right? They need support looking for work. We have case managers that are willing to go out in the field to support folks who need these services. A little bit about Housing Works. In addition to the program that we are providing, we also provide wraparound services like primary medical care, HIV testing, PrEP, PEP services, STI testing, LGBTQ specific services, substance use, pharmacy. We also have a food pantry, case management services, youth services. So we are a pretty huge organization providing a number of services. So in addition to executing this program through Connect, if we meet with the person and maybe Connect might not be for them, we're more than happy to connect them to other services that Housing Works provides. Now, what makes a person eligible for Connect services? Person has to be over the age of 18 or above, a resident of, that should say East Harlem. What I should mention is that the services that we're providing is through East Harlem and East New York, but I made a mistake here and I should have included East Harlem. Anyone who has a diagnosis or experience of emotional health concerns or distress, anyone who has recently been released from jail or prison, anyone who is stepping down for mobile treatment services. And for folks who may not know, we do have services where folks will go to your home and provide you with psychiatric services. And that's through ACT, FAC, it's under the umbrella of SPOA. But at the end of those services, because there is a limitation, these folks they don't have anywhere else to go. And the waiting list for OMH services is through the roof. Folks are waiting months for their mental health medication, months for their behavioral health medication. And we're here to sort of like really fill in that gap. So these are sort of like the eligibilities for folks that are interested in the Connect service. So why East Harlem? Again, I know I'm preaching to the choir, folks that understand the importance of advocacy, but East Harlem, the community members of East Harlem, because they face racism, because some of them are facing income and poverty disparities, because of education, low education attainment, and in some cases unemployment, because of barriers with transportation, an increased number of homelessness, housing instability, insurance coverage, like all of these issues, all of these barriers make someone more susceptible to behavioral health concerns. And we understand that, and that's why we're here. Now, the importance of community engagements. Again, we are not pushing the agenda. We are letting the community members push the agenda. Again, you all know as community board members, the importance of like working with the community in order to get, one, understand what your role is in the community, right? But two, to support the folks here, right? So working with the community, we know empowers community members, right? Working as a group, knowing that we have the funding, it addresses relevant community needs, right? It contributes to community change, working with an organization, right? It strengthens social inclusion, right? And then working in numbers, right? There is power in numbers, right? It leads to higher solutions, right? Higher quality solutions. And so there is power in working with the community to really support us in this program, right? We literally cannot do this without the community's help. So it's just so important that we work with the community in order for us to sort of like really get this off the ground and running. So you'll see us around, right? And what will that look like, right? We will be tabling, right? We'll be attending your local community boards. We'll be distributing surveys, conducting focus groups, also that we can get information from the community to really tell us what is it that they need, what are the things that are affecting them right now, how is it that we can support and improve your quality of life, right? We're working with Housing Works in-house referral systems. We're working with different partnerships throughout East New York and in East Harlem. Like I said, we're working with local bodegas, restaurants, libraries to really support us in this mission. We're doing community mapping projects. We're providing psychoeducations. We're canvassing the community. We're working with our elected officials. We're also providing wellness offerings, so like yoga, cooking classes, because we understand that getting folks in groups really eases folks and gives them an opportunity to really speak the truth and really tell us what is it that they need. And that's just a few things that we're thinking about right now. And again, we're letting the community really dictate what we do. And so we're hoping that the more and more we get the information out, the word out about Connect, the more and more the community will become familiar with us, and the more and more comfortable they'll feel giving us information about what they want to see within their community and how is that we can support them. These are some partnerships that we've developed and some partnerships that we're looking to develop, because we understand that these are organizations or folks or systems within the community that are super important. So again, we're working with Housing Works into departments to really get referrals and to get the word out about the program. We're working with NYCHA. We're working with, we're hoping to work with DSS services. We're hoping to work with Public Library. We're hoping to work with Department of Corrections, faith houses, senior centers, community centers, local businesses. Again, we can't do this work without them. We can't do the work without the community. And so it's just so important that we build visibility within the community so they know that we're here to support. And most importantly, we are working with you all to really just support us and guide us and tell us what is it that you need to see to feel a greater sense of quality health, right? So that's it. If you need some more information, that's my name. I'm Natalia, again, Program Manager for Community Strategy at Housing Works. And my director is Alika Naret, and she is the Director of Community-Based Behavioral Health Services. Before I end, I do have a short survey that I would like everyone to complete whenever they get the chance. Again, it really is just us asking, what is it that you need us to provide in the community so that we can support the community and really address this, the need for mental health treatment. So that's it. Are there any questions?
Yes, thank you very, very much. So I'm going to first, thank you for a very thorough presentation. I was typing up questions and the presentation was answering right off the bat. So that's a great thing. I did have a question. Can you put me in a situation? I want to go back to the, you said on the spot, some of the on the spot services that could be on the spot therapy. What type of distress calls would, could you give us an example of what that would look like? And then what sort of, therapy, I want to use the right words. That's what I'm trying to think.
Yeah, therapy is the right word, yeah.
So what sort of therapy would it be? Because you spoke about traditional and non-traditional approaches. I know having the on-the-spot sort of therapy can be traditional in some areas, but non-traditional in others. But what about the actual, form of therapy that's being provided? Like what would a situation be, and then what's the skill set of some of the case managers going into work these?
Okay, so I just want to be able to reiterate the question. So I think what I'm hearing you say is, because I said non-traditional therapy, you want to understand what that means, right?
In a real situation, so if you got a distress call on Wednesday, are you going to the home provide traditional that form of therapy, or is it really tailored to the person? Like, what does that kind of look like?
Yeah.
In a real situation?
So traditional therapy. What I do want to say, it's not that we're providing non-traditional therapy, right? We do have therapy that works. What we're doing is we have a non-traditional approach, and the non-traditional approach is literally meeting the folks where they're at, as opposed to folks coming to us. So let's say someone is interested in services, but they're not interested in coming in to our clinic. We will literally go to their homes and provide them with therapy, right? Some barriers to some folks, coming into therapy is transportation. I can't make my way there, right? Or, they don't have daycare, right? Like, they have a child, and because they have a child, they can't afford a babysitter, things like that. Then there are folks who are just not comfortable, right? Stigma is real. Not comfortable walking into a mental health clinic, not comfortable walking into a clinic and asking for mental health services. So they're more comfortable going to, I don't know, your local coffee shop. So we're willing to send therapists there to your local coffee shop so they can provide you with traditional mental health services. So literally just meeting the folks where they're at.
Thank you. That last
Yeah.
part answered all of my questions. I appreciate you very much.
Yes, we do provide virtual therapy. I saw a question in the chat. We do.
Okay. Yeah. So
But for some folks, I'm sorry. I just wanted to continue with that.
Go for it.
For questions.
Yeah.
We do provide virtual therapy, but for some folks who maybe they don't have access to reliable phones, right? Maybe don't have access to reliable internet, right? That may not work, and that's why we exist.
So I'm done with my questions. Are there any questions from any of the board members before
I think I saw. It looks like Joseph has his hands up.
Yes, but let me entertain questions from the board members first, and then we'll go to the public. Seeing no hands from any board members?
Oh, okay. All right.
Cool. So
If
Joseph.
that's
Okay.
Sorry.
So we have a few in the public session. So yes, Joseph, please. Can we unmute? Yes, go for it.
Oh,
Joseph.
okay.
Hi.
So oops. Someone else want to go first? They're more than welcome.
No, go for it.
The dog.
Okay. So I had 3 questions. One, you had the slide up with the various eligibility. I was curious if you have to meet all of those eligibility requirements or just some of them?
Just one.
Okay. So
Yeah, and
basically
then
the 18 and up.
And then we
Okay.
also do a thorough assessment. If you decide that you're interested in the services, where if we decide that Connect may not be for you and that doesn't happen, then we'll refer you appropriately to someone else.
Okay, and then the 2 other things, you mentioned tabling. There is going to be an older adults health fair in September. So you or whoever is position that is to do community engagement may want to connect with me to get involved in that if you are.
We would love to.
And I'm also a part of the East Harlem Community Health Committee, and we do have a mental health subgroup, which I think maybe someone from the organization may be interested in getting involved in.
Yes, please. Joseph, do you mind putting your information, or I'm not sure how this works. Can he put his information in the chat and I can take that? Or how does this work? How can I exchange information? Or rather, you know what, Joseph, I'll put my information in the chat, and would you mind following up?
Yes.
Perfect. Would you mind following
please.
up with me and sending me an email with all of this information? We'd love to support with the tabling and the other committee.
Yes, I already jotted your thing down from your last slide, so.
Awesome. Thank
Yes,
you.
Natalia, if you can put your information in the chat for everyone.
Okay, so I'm putting my information in the chat, and right below my information, you'll see a link to a Google form. And again, that's the survey that really just asks about things that you'd like to see within the community, whether or not you see a need for mental health, the services that we're providing. So I will put that in the chat right now.
So you go ahead and do that. I'm going to entertain the next question from Crystal Glover.
Hello. Hi.
Hello.
Hi.
So Natalia.
Yes.
So hi. Okay. So I'm in East Harlem, and I just wanted you to know for the record that NYCHA Development's resident councils normally break between from July to August, so their meetings don't start back till September.
Okay.
So if you were to contact NYCHA resident councils, June, this month is moving quickly. So by the end of this month, they won't be meeting in July and August. Okay, so that's just food for thought.
Thank you for letting me know.
You're welcome. And a lot of the HPD buildings in East Harlem, we used to call them tenements when I was coming up. They always feel left out of everything. You know, everything is NYCHA this and NYCHA that. And NYCHA has so much. NYCHA has tenant participation activity funds that they get from HUD, that the resident councils can form all kind of meetings and workshops and stuff like that. Where HPD tenement buildings, they don't have all of that. Okay. So when I would like for you to focus more on those HPD buildings because they tend to feel left out.
So you said
I
HPD
think they call them
tentative?
HPD, but we used to call them tenements when I was growing up. I'm not clear what they call them nowadays. Buildings that usually have walk-ups and I'm not sure. You know, buildings that you see in the community that's not NYCHA. Okay.
Got
you
it.
Look at East Harlem, any building that don't look like NYCHA, you know, tall buildings, 14-story, etc. Perhaps you can focus on those like 103rd, all up in there between Lexington and Third, etc. So that's just
really good to know. Thank you. This is exactly why we're here. Like, traditionally, when we think about reaching out to different housing developments, the first thing that comes to mind is NYCHA. And so I'm glad to know that that extends past NYCHA. This is good to know. Thank you so much.
They feel left out. These buildings on the side, you're kind of young. You're a lot younger than me, so you may not know what a tenement is, but they're normally walk-ups. They have garbage cans in the front of the building. Well, you can ask someone at they can fill you in on what that is, what a tenement is. But NYCHA has a lot of stuff. When we hear about, oh, NYCHA don't have this, ain't no jobs, they ain't got this, they ain't got that. I'm here to tell you that there's a lot that NYCHA have. And what NYCHA does is they put everything in black and white. So if you're not reading what they do, they can say, well, we posted that, we put that up. If you ain't reading, if your board is not filling you in, etc., don't blame us. They always cover your back. So try to, in East Harlem, try to focus on those buildings on the outer skirts of NYCHA. Not that you don't need to focus on NYCHA, but those outer buildings, because they always feel left out. The other thing I was going to say is that when it comes to mental health screenings and so forth, I remember when de Blasio's office, they brought, I think it was Thrive, and they have a phone number, We Help or We Hope, something like that, and all this kind of thing here. 24-hour services.
And Hope.
Right. You know, 24-hour services and stuff. And it just cracks me up how there's so much out here already that we have so much stuff that we don't utilize till it's just ridiculous. There are, you know, the mayor's office and city council and all this kind of thing here, but we always acting like we are so, like we in Stone Age or something, or like we're in a third world country. We have so much here already. So when I hear of another program, I'm like, another one, you know, and stuff like that. But I'll leave it there.
Thank you so much, Crystal. I appreciate it. Thank you.
So, thank you, Crystal. Could we unmute Deborah Levine?
Hi, sorry, I was moving around. I just wanted to say thank you for the presentation and wanted to know if I could reach out to you because we're actually launching a mental health coalition across Harlem, and we'd love to be able to partner with you.
It sounds like you'd like to partner with me. I had trouble listening. I had trouble hearing you, but it sounded like you wanted to partner with us. Absolutely. Absolutely. We're looking for partners.
Sounds like they're launching a mental health initiative.
Yeah, I will definitely reach out. Sorry, I had to keep moving and it's super noisy out here. But I will definitely reach out. Thank you.
Perfect. You're very welcome.
Okay, could we unmute Travis Thomas, please?
I unmuted all of them, so they have the ability to unmute themselves on their end.
Okay, thank you, Marlene. Appreciate it.
Hello, hi.
Hi, how are you?
I'm good, thank you. Hello, Community Board 11. This is Travis
Hello.
Thomas. I feel so blessed, Miss Natalia. I came on the line just in time. I'm the founder of Save for Life Cancer Corporation, and we just opened up our S4 LCC cancer resource stations in different boroughs. And this is amazing because we provide free cancer patient navigation and resources to our patients and our clients. And we have no mental health partnership. So you are right on time.
We are here.
It's exactly what we needed for our newly diagnosed, our cancer patients, as well as their families. So I am looking forward to connecting with you. I put my information in the chat, and I would love to talk to you about doing a presentation for our Cancer Patient Resource Navigation Network meeting that's coming up on the 23rd. Thank you so much, Community Board 11, for having her. This is a gift. I appreciate it.
You're so
Thank
sweet.
you,
I'm so
Travis.
glad this is being well received. You never know how folks are going to receive this information, but I'm really excited that you guys are receptive. Thank you.
Yeah, no, definitely. Thank you for coming before the board and sharing this information for these purposes right here. Connections can be made, more people can be helped and receive the support they need, right? That's how we do it. We connect, right?
Right, exactly.
That's what's happening right now. Great. All right. So I don't see any more questions. I'll throw it in the air again. Oh, I see that. Marlene. Yes, Marlene. Sorry.
Yeah, I didn't want to cut you off. Natalia, can you send me the presentation by email so I could send it to the committee members?
Absolutely. I'm going to just add East Harlem in the slide, and I will email it to you. Thank you so much. Thank you so much. I just want to send a gentle reminder, please complete the surveys. This is how we know what we need to do for you guys and how to support the community. Thank you so much for your time.
Thank you, Natalia. Thank you very much. I'm definitely going to second what she just said. Please fill out that survey because we're always talking about community input. And this is the way we give input. That was one of my first questions. How does the community weigh in? You had a whole list of ways. I was like, yes.
There you go.
So that's what's up. That's what's up. All right.
The
Thank
community
you,
drives our agenda. Thank you so much. Thank you for having me. Have a good night, everyone.
Bye.
All right.
Bye, Marlene.
Bye.
Okay. So with that, we're going to move it along. I muted myself. I wonder how much I was talking muted. How much did I hear you say?
You said you're going to move it along.
Okay, great. Okay, cool. So we're moving on to old business now, right? This is the last thing on our agenda. This is us revisiting our revisiting our assessment tool, which is our survey to learn more about the social service providers in East Harlem. I'm gonna share my screen and I want to walk through this form. And I'm hoping that, I'm hoping you have some time to look at it before today, because that would be helpful. But I understand busy schedules, so it's okay if you did not. Can everyone see my screen? Okay. So without saying too much, this assessment tool, I'm going to just say this survey. Let's just call it a survey. Let's not call it a survey because it's not like a question. It's more like we want to learn more about you, not like is there a right or wrong. We're going to judge you if you do this or do that kind of thing. So we're not going to. I want to use my language correctly, right? We want to know more about who is in East Harlem, right? We also want to better understand the landscape of a few things, right? One, substance abuse treatment in our community. That way we can be able to advocate most effectively, for our community's best interests, right? We need the information, right? We also want to identify social service providers more broadly, right? Like those traditional approaches and those innovative approaches, like we just had Natalia come on and let us know what they're doing, right? So this is important that we sort of throw a net out to see who's out there. There's a lot of folks doing work in silos. I've met a lot of people, who don't, come to the community board to let, we may not know about the work that they're doing, and there's folks who are doing work in a very personal capacity with just a few people. You know, we want to know about that because people sort of transition out of programs, and there are spaces for other people to transition in. So we do want to know large or small, you know, traditional, innovative. I don't want to use them as contrasts, but we want to know the spectrum of the social service providers that are here in East Harlem more broadly. We also want to establish and maintain a healthy working relationship with organizations who come before the board. We want to be able to ask informed questions when folks come before the board. You know, we don't want to be attacking people or just upset with the idea of what we think their presence means versus actually having the information about this organization and seeing how they may be contributing to our community, right? So that's like my mini sermon before we go through this, right? So I'm gonna, just for the sake of the record, I'm gonna read through the whole survey, right? Forgive me, I don't have on my glasses, so I have to make the words bigger. I'll get upset. Okay. So essentially, we want to either send this out to organizations. So I imagine it this way, very much want you all's feedback, that we would reach out to organizations within the net of who we are able to get and gain contact information from, those we know, those we hear about. We'll reach out, we'll send the survey, and they'll have the option to, you know, print it and fill it out. Some folks like to do that, or you'll be able to click on a Google link and you'll be able to fill out the same form. So just to make it a little more easier for people, because some people may be, you know, traveling at the moment, it may be ideal for them to just complete the form while they're en route, you know, somewhere on the train or the bus, and they don't necessarily, you know, have the capacity to print something out. So we just want to make this as easy as possible for folks to be able to fill out. So organizational questionnaire. This is open for, the reason we're going through this is because I need the board members, I need you all to give your feedback on this questionnaire. What purposes do you believe it should serve? Maybe I didn't mention something. As we go through this question by question, please critique the question. Let's talk about the question. I'll tell you in advance that the questions came from several surveys that I have seen floating in our Google Drive from, you know, just previous attempts to do this, what we are doing now. So I think I had one which was an original one, and then I seen one of our previous board members had edited one and tailored the questions a little bit more. So I went in and I sort of meshed those two together and also tailored some questions in there myself that I thought were pertinent to what we want to know from organizations who are providing services in our community. So with that, this is all open. I've got the screen up right now, so we can edit stuff right now. I might even just go in suggesting mode, depending on the sort of changes we want to make. It may not be, but some changes are significant. We want to just keep on track of the changes we're making as we're making them. But every question, every word on this document is up for discussion. I don't mean for this to take a long time. I'm hoping we can get through this, but I am going to take my time through this because at the end of it, we will need to vote on it in order to use it as a committee, right? We don't have to, and Marlene can correct me if I'm wrong here, we don't have to, the full board doesn't have to vote on it, it's just the committee has to vote on it in order for us to use it. Am I correct, Marlene?
Yes.
Thank you very much.
The full board doesn't have to vote, but you all have to vote as a committee, just as a consensus, you know,
Yes,
for the record that you'll be using it.
Great. And depending on, let me not get ahead of myself. Okay. Organization questionnaire. Community Board 11 wishes to establish and maintain healthy working relationships with the organization serving our community. We ask that you complete the following survey to help us to get to know your organization and its work better. We understand instructions. We understand that organizations are formed and structured differently. All questions require an answer. Please do your best to answer each question as best as possible and mark not applicable or NA where questions do not apply to your organizational structure. Number two, We understand that CB11 is home to many for the purposes of this survey, and I even used the word survey after I just said that. So we should talk about that maybe. Anyway, for the purposes of this survey, we will use the term East Harlem to include East Harlem, El Barrio, Spanish Harlem, Randall's Island, and Ward's Island. So just a reminder, so folks know when we say East Harlem in this context, for the context of this survey, we are actually talking about all of this. So this survey, just make it a little smaller, get myself closer. So this survey is actually broken up into a few components and just sections. One for the contact information, there's a section for the organizational information, there's a section for the actual program, services, and initiatives run by this organization. And there's also a section for a request for additional information. If there's anything in these sections that we did not ask for. I'm going to start here at the, I also would like to, if this is okay, board members, you have the power to unmute yourselves. So please just jump in as I'm reading. I will, you know how I am. I will throw a question out. If no one says anything, I'm going to move on. I'm going to keep it moving. So please unmute yourself and please jump in. So for the members of the public, this time right now, us going through this process is only for community board members. So at this time, I will only entertain comments and suggestions from board members. Okay, so our first section, organizational contact. So we ask the people's name, their email, their phone, the organization's name, its address in East Harlem. And we also ask that they list any additional organizations. Some organizations have multiple locations. We also ask that they give us the name of presenter or point person, someone who could come before the board, maybe a liaison for us in some sort of some capacity. We also have a question for, would you or a member of your organization be willing to visit the committee to give regular updates about the work that's being done in East Harlem? So this one is really just a sub question to this one, if you will. So this is the organizational, this is just the contact information. Are there any additions any board members feel we should make in this section, or are there any subtractions, any comments, thoughts? Please just unmute yourself and jump in, just for the sake of time, so we can get into discussion about this. If not, I'm going to just hold for a few seconds and then move it along. And Marlene, I know that I was probably annoyingly managing the raise hands before, but right now I can't see it. So if people, if any board member does happen to have their hand raised, please.
Okay, yeah, no problem.
Thank you very, very much. And I'll leave the participant stuff alone, right?
Okay.
Okay, cool. All right, so any thoughts, suggestions, comments, pretty cut and dry? Anything, anybody want to add any feedback? We good? I see a thumbs up. I'm gonna slowly push it forward. Let's make this thing. Okay, so the organizational information. So we ask organizational status if you're a not-for-profit, if you're a for-profit partnership, or if you're a for-profit corporation, local government entity, state government entity, federal government entity, et cetera, whatever it is, who you are. You may be a group, maybe a person, who has your license to do something. We want to know who you are. So just wanted to make this as inclusive as possible. Maybe we can also add here fiscally sponsored group. So just for any board members who's not who just probably want to ask, so maybe I'll just say it. fiscally sponsored program or group is just a group who doesn't have a nonprofit status. So they get a fiscal sponsor, which is another organization that can act in proxy to receive nonprofit funding on their behalf. Okay, so the second question, we also ask, how long has your organization been operating in East Harlem? This is important. We do want to know, who our long-time, sort of community stakeholders have been versus the ones who are new to the community, right? We also ask folks to please provide their annual report. We ask that folks provide their annual report because we want to know that the work that they're doing. A lot of times, annual reports are different depending on the type of organization. Annual reports can provide information from the spectrum of funding and budgeting, all the way to like just completed projects and initiatives and scope of work of what was done by an organization. So we do ask that organizations provide their most recent annual report so we can get a sense of the work that they have been doing and at what level they've been doing. Right? So number 4, who has authorized your location in East Harlem? So this is only relevant for certain organizations, right? So again, this is one of those questions where a certain organization may mark NA because it may not be applicable, but this may be applicable to other organizations. So they should answer this question. So number 5, does your organization have a community advisory board? If so, when does it meet? What is the recruitment process for the community advisory members? If not, do you believe that your organization would be more effective by establishing an advisory board? Please take this opportunity to share any capacity limits that your organization may have in this regard. So this actual last part was just in all fairness, some organizations are not operating with a lot of members. So to have the capacity to have an advisory board or to manage and maintain it may not be within that organization's capacity. So we just want to acknowledge that. But we would like folks to share that if that's what the case is, and because in those cases we want to find out how we can maintain a working relationship with these organizations so that we can communicate to them, hey, this is what we're hearing from the community, this is what the community needs, and we just want to make sure that you're rocking with us. We all on this together, so with that. So that concludes our organizational information. I also just want to say that for organizations, I really do want organizations to fill this out. So I didn't, just in drafting this to bring it before you all, I didn't overdo it on the questions. I wanted to just ask just enough questions for us to get enough information, but not, do too much. So just, hence the, 5 questions with a few sub questions. I will just take a moment to pause, drink some juice, and if there's anybody who has any thoughts or feedback on this section, any suggested changes or updates we should make, please feel free to speak. Copy. All right, moving along. So this section, we wanted to know a little bit about the program, services, and initiatives of this particular organization. So what program services does your organization provide? Why is this service or program important for East Harlem? So this is important. This is a question I feel every organization that decides to work in a specific community should be able to answer. If you decided, when you did your location scouting and you thought to go to this location, why did you think to go there? How does your program or service benefit specifically this area? So that question definitely is number 1. So the next question, please explain your organization's current service capacity, beds, etc. So maybe a number of clients. Let me just ask. I'm talking, I'm just thinking. So yeah, So what's the current service capacity? You know, how many, you know, people can a particular organization sort of be able to withstand and provide services to, adequate services, quality, adequate services, you know, not stretching themselves thin, trying to do too much. So we do want to know. So the third question is, what is the current estimated percentage of East Harlem residents, families served by your organization? So this is also like one of those questions up there with number one that folks should answer. You know, we should know this. We do want to know this. Is very, very important. You know, does your organization provide services at locations outside of East Harlem? This question is sort of double answered. I would say, but I don't think we should take it out. It's because we asked up top, you know, do you have another location? So, you know, we don't want to assume that that other location provides the same service. So maybe this question should be here just to distinguish between those two questions. Definitely open for thoughts on this question. Or questions. So without, okay, so the fifth question, what is the current percentage of East Harlem residents currently employed by your organization, right? How many are there opportunities, you know, available for East Harlem residents at, you know, particular organizations, apart from being clientele? Are we able to grow in leadership, you know, secure positions there, you know, to really be able to have a community representation, you know, in these organizations, right? So number six, what is the percent of services, treatment, modality provided to East Harlem residents versus clientele?
I'm a little confused by that, Isaac.
Yes, I am very confused.
I mean, I think what you're trying to ask is what percentage of your clients are based in East Harlem? Isn't that really what you want to know?
You know, I don't think I had this question. I think these are one of the questions that I left in that was already there, so that we could.
It's misleading.
Okay, so let's talk.
Or it's not obvious, either one.
Okay, yes. So I'm actually not. I guess it could be just as simple as
So really what you want to ask is what percentage of your total client base reside in East Harlem? Yeah.
So what percentage of your client base? What is the percentage of your client base that lives in East Harlem?
Mm-hmm.
Thank you, Rob.
Of course.
So number seven, how does your organization partner with other organizations, local or otherwise, to provide the best quality of services and resources for East Harlem residents? So this question definitely, I think personally, coalition building and strategic partnering is how we get work done, you know, connecting, you know, so it's important that organizations are working with, you know, other organizations, businesses are working with other businesses to ensure that, you know, our residents are, you know, being cared for, you know. So, excuse me. Okay, so number 8 would be, please share your organization's assessment regarding issues impacting the neighborhood of East Harlem and its residents, written or observational assessments. So this was a question I particularly drafted out. I'll try to say what I was, if it's not clear, what I was asking was, I just added on to a question that was just asking, what do you believe the issues are in East Harlem? So maybe there are some formal assessments that are being made, or maybe there's just some observational ones. Maybe there's organizations who, you know, maybe they have to take out the garbage every morning at a certain time and they see a particular thing every time they go out. Or maybe, you know, there's an actual committee at an organization who is tasked with doing an observational or some sort of assessment of, the community needs, as Natalia is with Connect. So just asking information about what assessments they've done regarding issues impacting East Harlem. I wonder if does anyone feel like this question needs rewording? Is it confusing in any?
I think what you're really asking is really, what do you see as the needs in East Harlem that you specifically meet? Is that what you're thinking?
I think to not you personally, but your organization.
The organization, that's what I meant. Yeah, that's your, yeah. Because I'm sure that most organizations, just like you go through a needs assessment, we go through needs assessment, I'm sure organizations do too. But there's one question that I haven't seen yet, and I wonder if it's here.
Oh, wait, before you go there, help me to
Sure.
reframe this one. So what was that?
Sure. Please share your organization's needs assessments regarding
issues impacting
your client base in East Harlem. Because it's going to be different depending if is this a mental health provider, is this a social service provider, is this a housing provider? They're going to be different based on their orientation, right? Regarding issues regarding your client base in East Harlem. I think that's basically what it is.
So please share your organization's needs assessment. Just in case there's more than one. Please share your organization's needs assessment regarding issues impacting your client base in East Harlem.
And maybe, and how do you address them?
Is that cool?
Yes.
And how do you address, how does your organization? Okay, cool. Now tell me that question that you said you haven't seen.
Yeah, my question is, are your services free? That's my question. I don't know if that it shows up anywhere.
Okay.
I don't remember.
No, it doesn't. It doesn't. It absolutely doesn't.
Okay.
Okay.
So really, Isaac, I think there's two questions here, unfortunately. Do you have, what is your criteria for providing services? What is your organization's criteria for providing services? And are there fees for your services?
Okay. Okay, so the question I'm trying to ask here is like, do you help people to find ways to pay? Like if I was
Yes.
like
Do
financial
you
aid.
referrals? Do you make referrals to help? Do you make referrals in that case? But my colleague Joseph has also asked a really good question. Is there a sliding fee based on? Do you have a sliding fee?
What is?
Because
Tell me. What is that?
because well, the sliding fee might be based on income, for example. Do you have a
Okay.
sliding? If you do charge, is there a sliding fee?
That means that if you make more, you pay more.
Yes, it should. But I don't know. It seems like no rules apply anymore. So good, we're asking these questions. Thank you, Joseph.
Okay, so okay, so what are your company's criteria for providing services? I feel like that is your what criteria is closed.
For example, our agency, you have to be at least 60 years old. You should live in our service area, and our services are free. Not everybody's the same. Do you provide referral resources? Yes, refer resources, vouchers, referrals, yes. Bill?
Okay, how is this looking? What are your company's criteria for providing services? Are services free? If not, is there a sliding fee? Who is left to pay the bill? Are there resources, vouchers, referrals, etc., to help offset fees?
Excellent, you covered all your bases.
Okay, so let me, I feel like maybe is everyone going to know what the term sliding fee means? Should I put there if you fees are adjusted based on income, right? Something like that.
The term, I don't know if I can speak, but the term is sliding scale. That's what people know it as.
Okay, thank you.
Thank you, Joseph D. Benedetto.
All right, I still feel like this is okay. Let me just ask this in a different question.
Yes, that works too.
Okay, so who is left to pay the bill? That's the question. Okay, are there resources, vouchers, referrals, etc., to help offset fees? Okay, cool. Is this good? How you feel?
Yes. Yes, thank you so much.
Okay, so number, okay, so I put that on number 2. Sorry, where were we at? Yeah, I think this was the last question we added, number 7. Okay, how does it, no, number 8. Nope.
Up to number
Okay.
10, Isaac.
10, yeah. Yep. Thank you for that, Robin. Slowly making my way through. Okay, good. So just with my recent skim, all of these did look good. So that's great. That's great. So we're up to number 10, and then we're only like 3 or 4 questions away. Thank you everyone for being through this. Okay, please provide copies of any complaints received by your organization regarding your East Harlem location. For example, issues covered by internal or external audit or complaints filed to you and other government agencies about. I don't know if we need this. This was another one of those questions that I just dragged and dropped over. So I don't know if we need this in the past 2 years, or do we want to? I don't know. I don't know to what extent we're holding this against people. I know we want to know it because it's good to know.
If it was me reading it and that something happened 25 years ago, I wouldn't tell you.
Yeah, I totally get that. I totally get that. So so we should say in the past 2 years.
I think that's great.
Put it, yeah. Statute of limitations is 2 years.
I don't know.
After that, you good?
Don't tell, don't ask.
Let's say, I don't know. With that in mind, can we say 5 years?
Sure.
That's realistic. 2 years is like, that was like.
But that was just pre-COVID.
Yeah, right. That was like yesterday. Wasn't too long ago. Right. Okay, cool. All right. So please provide copies of any complaints received by your organization regarding your East Harlem location. For example, issues uncovered by internal or external audit or complaints filed by you and other government agencies about your services. To you. Okay, yes. Okay, number 11. When is your program, next up for review, audit, or reauthorization, excuse me.
Yeah.
That is relevant. That's one of those questions that will only be relevant to certain people, as most of them are. But it is a question that for those who do go through this process regularly, we want to know about it. So that with that concludes the program services and initiatives section of the questionnaire that we'll be sending out. So question. Okay. All right. So any comments, thoughts? Thank you very much, Robin, for helping out. I really appreciate you.
I do have another thought, Isaac, and that is because this community board carries a list of community resources on the website, which could be a great place to put these information about these very organizations. So I think that in addition to saying why you're asking, it's because we're developing a list of community resources that is going to be housed on our website. We're updating our community resources section on our website. We'd like to share the work that your organization, whatever. Thank you.
Okay, so here's where I look to insert this. So Community Board 11 wishes to establish and maintain healthy working relationships with the organizations serving our community. In addition,
You
we
are
are
smooth.
thank you, I appreciate you. In addition, we are updating our community resources section on the CB11 website and would love to share the work that your organization is doing in East Harlem. We ask that you complete the following survey to help us to get to know your organization and its work. Good. Thank you very much for that insert, Robin. That was
Yep.
good. So let's go on down. So we're now at our final section. We made it. So this is the request for additional information. Is with all of that, those sort of questions were categorized into those other terms. They're just any broad general questions we want to ask that don't seem too invasive on an initial. Maybe we can ask those questions when they come before us, but just some questions that, we didn't list here. And I definitely want to, I think if it's okay. Yeah, so yes, I'm sorry. Yeah, so could any thoughts on these additional questions? The first one that's here is please detail what, if any, client safety and public safety measures your organization has put in place to assist its clients and the surrounding community. This question comes from the understanding that we have a lot of visitors who come to East Harlem. So just ensuring that folks are not, sort of receiving services and just sort of lingering. If there's a way where organizations are ensuring that, folks are able to safely make it from, the place that they receive services to their destination safely, and just ensuring that they're safe and everyone around is safe. Not assuming that they're making things unsafe in any way, but just we want to ensure that folks are, able to make it from one location to the next. But we want to know what safety measures organizations have already put in place. This is a question that we've asked organizations like Exodus and other organizations. Yes, Robin, were you going to say something?
I just didn't understand it that way. I guess because we're not that kind of organization. I was just thinking about what we were doing because of COVID. So I think that's a good question.
Okay.
You could take it either way.
Okay. There's a big detail on safety.
It's a fine question, Isaac.
I haven't got into it, man. Hold up. There's your organization. Oh, that's not fair. That's just back. So please detail what, if any, client safety and I will say public safety measures your organization has put in place to assist its client and the surrounding community. All right, so the second question, what, if any, impact has your organization endured because of because of the COVID-19 pandemic as it relates to services, delivery, staffing, client participation? So just a question here, forgive me. Just a question here, wanting to know more about the organization, how COVID might have, sort of disrupted services, halted them in any way, or prevented them, or anything like that. if it's exacerbated in any situations as a result. So that's why that's there. The final question there, CB11 supports our local businesses and organizations. Please let us know about any issues or complaints that your organization believes CB11 should be aware of. I definitely thought this was a good question because there may just be information that an organization wants to let us know about that we may not be asking, something that they feel may be pertinent to us that we may
Good
not,
point.
we may just be overlooking and looking at one thing. So I just wanted to open it up for that.
Mhm.
I do want to just do one last sweep with the board members. Please unmute yourself if you have any thoughts or suggestions before we sort of, are we taking a vote, like a vote, Marlene? Just like a committee vote on it, on using this?
Yes.
Okay, so we need someone to actually call a motion and all of that stuff, right?
Yeah.
Okay, so before we ask for someone to call a motion to utilize this assessment tool, I just want to open up the floor again for any board members who may have any questions, thoughts, concerns, or anything they want to just bring before the committee. Seeing no concerns, I am going to ask, is there a motion on the floor to utilize this assessment tool to reach out to social services providers in East Harlem? Ooh, okay. Marlene, I can't see that. Are there any?
Oh, I'm sorry. Robin has her hand up, and Art put his hand up after Robin.
Okay, so we have a motion by Robin and a second by Art.
I move that we vote to accept this organization questionnaire.
Yes, and I second it, is Art.
Thank you very much, Art. Marlene, can we call a roll, please?
Arturo Perez. Yes. Pastor Isaac Scott
Yes.
and Robin Stration.
Yes, thank you.
Sorry, yes. I'm also
Thank you.
yes.
Thank you. Motion carries.
Thank you very, very much, everyone. Okay, this is great. So this is going to get taken as you see it here on the screen. It's going to get put into, it's going to be made an official CB11 document, if I'm correct, Marlene. And then we're also going to put it into a Google form fashion so folks can either, print it or fill it out online. Thank you. Okay, so that concludes old business. We made it out of that. Thank you. Okay, we do need,
Pastor
yes.
Scott is,
Yes, did I miss something? I'm sorry.
Crystal Glover has her hand up. I don't know if you want to recognize her because you pulled this out. Her hand has been up for a while.
Okay, I'm sorry. I can't see. Yes, I'm sorry. Yes,
Okay.
can I please? Yes, is it possible?
I don't know if she still has something to say.
Crystal, are you still there?
It doesn't seem like it. Okay.
Okay, maybe that was an old. Okay. Xavier, I'm sorry, Marlene. Is there another hand? I don't want to do. I told my. I don't want to just start managing the thing, like just jumping back and forth. I don't want to.
Oh no, do your thing.
Xavier, how you doing, sir?
Good. Lovely meeting. Thank you. Sorry, just still managing, child care here at the house. I know you understand. Great questionnaire and everything. Requesting information. It's wonderful. One thing, and again, if I missed this, apologies. I do desire, hopefully we'll be able to have a little bit of a reprieve over the summer so people can recharge their batteries. I would implore the committee to continue inviting back many of our service providers in the fall and really make it a chock-a-block. So very full meetings. We're really assessing our providers and as part of our holistic plan to heal and to make a difference long-term and advise not just our Community District 11, but working in tandem with CB10, 9, 12, and also our brothers and sisters in the Bronx, which we're currently establishing links with. So keep on carrying on, as they say, and very pleased to see this come out. So thank you, everyone, and just please stay safe. And I'm always accessible, as you know, and just this is brilliant. I love the detail. It makes me very happy. Data.
Thank you, sir. We appreciate you being here with us. Okay, so with that, I think we can close the old business. Is that cool? Everybody good? Copy. All right, so that concludes our old business. Thank you very much, everyone. We do not have any new business. So at this point, I believe that Marlene, you can do the roll call.
Yeah. Oh, Sandy Garcia. Jennifer Meyer. Oh, she dropped off. She did join, right? Arturo Perez.
Yeah, here.
Thanks. Pastor Isaac Scott.
Yeah.
Registration.
I'm here.
Thank you.
Thank you guys very, very much. With that, our meeting is adjourned. Everyone have a great night and a fabulous week. Thank you very much.
Thank you. Be well. Bye-bye.
All right, all.